benefits of these medications is they block this receptor, so virus cannot sit on it and get inside the cell. So this is another 2 studies that they are working on in Japan, that they are trying to use these 2 medications, camostat or nafamostat. These are 2 medications that I told you they are for inflammation of pancreas. They are studying them. So the third way of virus to get inside the cells is through this through the cell membrane itself, with no receptors. It just creates a sac, the virus itself, and these pockets, and with these pockets gets inside the cell. There are 2 medications again in the market that we are experimentally using, and actually one of them got FDA approval last week to be used as an emergency COVID-19 medication. It's an oral medication in hospitals. Is these 2 anti-malaria medications and lupus medications, hydroxychloroquine and chloroquine. Hydroxychloroquine and chloroquine prevent this pocket formation, and they don't let the virus to get inside the cell. That's one mechanism of action. The other mechanism of action that they think hydroxychloroquine and chloroquine have is they are used in lupus, which is an autoimmune disease. They are trying to regulate the immune system, and they optimize the immune system response against infection also. That's why in this dual action might help a lot. So imagine now viruses inside the cell. We also have other medications. We are different ways of, this virus is trying to get inside the cell and replicate and create itself and reproduce and get out of the cell. We have replication phase, and we have one of the phases of this factory chain production of the virus is called proteolysis. Proteolysis is a necessary step for the virus to create more of itself, and this could be blocked by that HIV medication Calitra that they are being used in experiments right now for COVID-19 patients, which is a combination of 2 HIV medications of lopinavir and ritonavir. The another phase in the reproduction of virus inside the cell is this translating and replication of the gene or RNA of the virus. There are 2 drugs that could block this phase. One of them is remdesivir, which is an IV medication. It created a lot of excitement inside US, and they are very optimistic about it. And the other medication is if I am not okay, favipiravir. Favipiravir is the medication that is being used for influenza. Influenza, we know that is also an RNA virus, and it prevents again this replication, this copy making from the RNA of the virus, and stops the copying of RNA virus. And with that mechanism of action, it could prevent further reproduction of viruses inside the cells. Actually, favipiravir is being tested in China, and they had good results about this medication. The problem with the favipiravir is it's not really effective in severe cases of disease. It has a good response against the mild to moderate form of viral infection in patients. So this is what we have. So for different ways of virus getting inside the cell, we have different drugs that can block it. And when virus gets inside the cells, for those phases also, we have some medications that could help us to prevent further reproduction of virus inside the cells and prevent further damage to the tissues and cure the patients. But these are all early stages of the studies, and all studies are trying to find out when to give these medications to the patient, when is the best time, what is the optimum dose to give to the patients. Very important questions. And let me tell you, we have about from the 100% of patients that they become corona positive, about 80 to 85% of patients are going to recover without going even to hospital. They can, under quarantine inside their house, they recover, fully recover with no problems, just like a flu-like symptoms maximum. And from these 15 to 20% patients that they are admitted to hospital, we need to find out who are these patients then from the beginning, because sooner we can treat these patients, better would be the outcome. That's a tricky question. That's a very important question that scientists are trying to answer. What are the markers that these patients have that we can predict if they are going to end up in a hospital bed? All these corona positive patients that they go to hospital, what are the characteristics? What is important? What's common between them? We know elderly patients, we know patients with diabetes, patients with asthma, with heart failure and blood pressure medication, with blood pressure problems. They are very prone to have more severe cases of coronavirus. But again, for sure, we are looking for markers, and if we could find this, we can predict this, and we utilize these medications much more effective, and that's what studies are trying to find out. What are those signs and symptoms that we can use as a marker, as an indicator that tell us, yeah, this is a good candidate we could use this medication on, and these are serious and important things that we have to keep in our minds. The third medication that we had in the market for maybe more than 45 years is anti-parasite medication, ivermectin, which is being used widely in different countries for parasitic infections of the in the intestine, like worms, and also for head lice. I've been using it for a long time, and we know all the side effects about this medication. The good thing is it's very cheap and it's oral. What they saw in Australia, in Victoria Infectious Disease Reference Lab in Melbourne, Australia, and also Infectious and Immunity Center in Victoria, again in Australia, and in Clayton in Australia. In these three centers, they use ivermectin. We knew from the past that ivermectin not only is an anti-parasite medication, it's antiviral too. It prevents viral replication or reproduction inside the cells. So what they did in Australia, interestingly, in the cultured cells inside the petri dish, they infected these cells with COVID-19, and they also included some ivermectin inside the cells, inside this culture media, and in 48 hours to 74 hours they saw viral replication stopped, and the viral load inside the cells dropped dramatically. This is a very good news, but what we saw was inside the petri dish. It remains to be seen inside the human body to see if we have the same effect. Very quick before I go, we need two proteins inside the cytoplasm of the cells for this coronavirus protein to attach to them, so they can get the green card to get inside the nucleus of the cell. What ivermectin does, it does actually prevent attaching coronavirus protein to these two proteins that we already have in the cytoplasmic part of the cell, and they cannot go through the inside the nucleus of the cell and reproduce. That's what they think is the mechanism behind it. So we have several options. These are all great news. I'm so sorry I had to speak fast. There are a lot of information. I hope I did not confuse you, but this is what we have. This is where we are, and we are very optimistic. There are a lot of scientists are working around the clock for this issue that we have right now. We can overcome. We have to stay positive, and there's nothing that we can put our mind and heart into it and we cannot overcome. This shall be overcome also, and we shall prevail. Thank you so much for tuning in, and thank you so much for your patience. Again, this video probably is in two parts. Please make sure to see both part 1 and part 2. Thank you so much, and see you next time. Okay, bye-bye.